A sick system when health is just a business. I went to an annual doctor appointment recently and it made me think. Have you ever noticed how everything in this country seems to send mixed signals? We glorify fitness and health. Celebrities post meal plans and gym routines. Commercials show you lean, smiling people drinking smoothies after yoga. But then we walk into a gas station or grocery store, and 90% of what's available is ultra processed junk. Cheap, convenient, addictive. We're told to live well, but sold what slowly kills us. And when that catches up to us, the American healthcare system is waiting not to heal, but to profit. And there's a paradox here. We say we care about health as a society, we promote wellness, but if you pay attention to how the machine actually works, you'll see that unhealth is far more profitable. From the food industry to the drug industry, there's a cycle, a pipeline. We get hooked on cheap, engineered food designed to override our hunger, flood us with dopamine, and leave us needing more. Then we get medications for the blood pressure, the cholesterol, the insulin. We get surgeries, CPAP machines, injections. It's not a conspiracy, it's just capitalism. Sickness pays better than prevention. It's addiction by design. This isn't about weakness or willpower. It's purely about design. Hyperpalpitable food isn't just unhealthy, it's optimized to keep us coming back. Food scientists literally run tests to find the bliss point, the perfect amount of sugar, salt, and fat that makes a food so irresistible your brain says more, long after your body is full. Addiction is part of the profit model. If we all suddenly switched to clean eating, stopped drinking sugary drinks, and cooked real meals for raw ingredients, the market would tank. Entire industries would collapse. Not because they failed, but because we finally got healthy. I guess that's the price of healing, maybe? Then there's the healthcare system and the cost of care. You'd think, after all the costs, all the suffering, we'd invest in prevention. We'd want to help people before they break down. But that's not where the money is. Preventing disease doesn't generate revenue. Treating it over and over again does. Hospitals charge thousands for routine visits. An MRI or a short ambulance ride can cost thousands of dollars. Insulin, a literal life saving drug, is marked up to absurd levels. Insurance companies play middlemen with your well being. The irony? We spend more on healthcare than any other country and still rank lower in outcomes. And the most bizarre part, when we get a chance to prevent disease on a massive scale, when we have a widely available, scientifically proven tool like a vaccine, a whole segment of society rejects it in the name of the same twisted freedom. We're told it's about bodily autonomy, but it ends up being a public health threat that serves no one but the very systems that profit from more sick people. It's a perfect encapsulation of how our deepest values are manipulated to serve a profitable, destructive purpose. And let's be clear, this is not a critique of the doctors, nurses, and medical staff on the front lines. They are not the ones setting these prices or playing these games. They are just as much a product of the sick system as we are. They are often burdened with immense student debt, burnout, and bureaucracy, forced to fight for what's best for their patients while navigating a machine that seems to prioritize paperwork and profit over well being. The blame isn't with people trying to heal us, it's with the structure that dictates how they are allowed to do it. We've built a machine that profits off keeping people sick, and then we act surprised when so many people are. It's like a shame game. And here's where it gets even darker. After all this manipulation, we turn around and blame the individual. You should have made better choices. Why didn't you exercise more? Why don't you eat healthier? But healthy food is expensive. Time is scarce. Stress is constant. And in many communities, access to fresh food or good care is non existent. We created the addiction, we sold it, we normalized it, and then we judged people for being trapped in it. That's not just hypocrisy, that's cruelty as well. Is this actually freedom or just control? And this entire system, this pipeline from addictive food to expensive medicine, is wrapped up in the language we hear so often: freedom. We're free to choose what we eat, free to refuse healthcare, free to go bankrupt trying to save our lives. But when those freedoms are structured by billion-dollar industries, are they really choices at all? If the only food you can afford is toxic, if the only healthcare you can access is exploitative, is that freedom? I don't think so. I think that's a rigged game. And I think true freedom, the kind that allows everyone to live a dignified, healthy life, requires a certain amount of collective responsibility. It requires us to agree that the food industry can't put whatever it wants into our food, that drug prices shouldn't be arbitrary, and that the public's well being is more important than a company's bottom line. In this context, smart regulation isn't the enemy of freedom, it's the guardrail that protects us from exploitation. Sometimes I think maybe we're not sick because we failed. Maybe we're sick because the system needs us to be. Because if we were healthy, really healthy, we'd be harder to control, harder to sell to, harder to extract from. Maybe the first step to a healthy society is to admit the system isn't broken, it's working exactly as it was designed to. And if we want to get healthy, we have to change the design itself. That's a different kind of freedom. What would a truly healthy society look like? Where food nourishes instead of addicts, where healthcare heals instead of drains, where freedom isn't just about the right to consume, but the power to thrive. Just something to think about out here on the trail.